Welcome to Grassroots from the Nursing Now Challenge, a programme of the Burdett Trust for Nursing. Grassroots aims to amplify the voices of nurses and midwives driving change from the ground up. We're shining a light on how nurses and midwives are shaping the future of healthcare, often in the most challenging of circumstances. This week, we're joined by Harriet Nayiga, a midwife from Uganda, and the founder and director of MILCOT, Midwife-led Community Transformation. During this episode, she talks with Zipporah Iregi, a registered nurse and Challengers Committee Africa Regional Hub Lead from Kenya, about the role of nurses and midwives in promoting planetary health, bridging environmental action and healthcare to protect communities and the planet.
Hello, everyone, and welcome to another episode of the Grassroots podcast brought to you by the Nursing Now Challenge. My name is Zipporah Iregi, the African Hub Lead for the Challengers Committee, and I'm so excited to host you for today's conversation on planetary health and sustainability in midwifery. Our guest today is an inspiring midwife and advocate whose work has made a real impact at both community and global levels, Harriet Nayiga. Harriet, welcome to our podcast today. Please introduce yourself.
Thank you very much, Zipporah. It's my real honor to be hosted to this podcast. My name is Harriet Nayiga. I am a midwife and the founding director of Midwife-led Community Transformation, MILCOT, which is a community-based organization that brings midwifery services closer to the community through bringing midwifery services closer to the community through preventive initiatives. And we focus on prevention of teenage and unplanned pregnancies. I am a champion of Nursing Now Challenge, and Nursing Now Challenge has really supported me from way back, even up to now. On the global stage, I'm also part of International Confederation of Midwives, who have empowered me as well in the area of midwifery. And I am doing quite a number of advocacy work in relation to adolescent health, as well as planetary health.
Awesome. That is so amazing. And a lot of us, are encouraged by your story. So just curious on how your journey into midwifery started. And, now that you mentioned the Nursing Now as well, how has that influenced you as a midwife, and how has being part of this global community sort of like supported you and your career?
Nursing Now Challenge, I joined the Nursing Now Challenge in 2019. When the campaign was starting to uplift the profile and status of nurses and midwives. And I was enrolled into the program because of the work that I was doing in support of marginalized adolescents and young adults, where we support them to get sexual and reproductive health services, which they are unable to get. Throughout the journey, Nursing Now Challenge has exposed me so much. I believe this is something that is very, very important in the journey of a midwife or a nurse. And I have been exposed to the global network. My work has been seen. It was just in closed doors, but Nursing Now Challenge has exposed it. We have worked together on a number of projects, especially in developing leadership skills for nurses and midwives. And that was the project that I did during the International Year of the Nurse and the Midwife. And my work, after being seen, I realized that many nurses and midwives were inspired by my work. And I am sure many of them have been influenced to do quite a number of initiatives. And that gives me joy, of course. So I'm really part of Nursing Now, and I'm honored to be hosted even on this very, very important podcast. And many of my partners that I have got of recent, it's because I got this very, very important exposure by Nursing Now Challenge. I remember when I was introduced to Her Royal Highness, the Duchess of Cambridge, and I had an interview with her, and she had the work that we do at MILCOT. It really gave me much joy and courage and motivated me to move forward. So even the recent partners that we have, it's been because I have been exposed out there. So I believe that any midwife or nurse who gets an opportunity to be empowered by Nursing Now doesn't remain the same.
That is amazing, and your story is indeed very inspiring. And I'm sure people listening to us today will be encouraged to join the Nursing Now Challenge as well. So, just taking you back to your earlier days, what led you into the journey of midwifery?
I had actually wanted to be a nurse, and I didn't know how nursing and midwifery existed. So, as I was advancing into my early career, my lower level education, I got an opportunity, and the government gave me a scholarship, which took me to the nursing institution where I studied midwifery, diploma in midwifery. That is where I realized that women really need the support of a midwife. And my work went beyond physical healing of the mother or children. I went beyond that and started to care for their soul, especially the adolescents and young adults whom I found in the labor ward when they were suffering. They were going through hardships to get the necessary, requirements in labor. They couldn't get anything. So I developed a hotspot for them, and my midwifery continued to develop around those areas. And when I finished my diploma, I was awarded as the best practical midwife of that year in 2013. And that is when I really realized that midwifery is such a very, very important profession that is needed in the world. So, midwifery developed within me after seeing seeing mothers going through a lot to bring out the baby, to have a smile at the end of the day, just because of the care of a midwife. And that is why I am so happy that I care for women today.
We really applaud you for the wonderful work that you're doing in those communities to help, mothers as well. But of late, you have been very interested in planetary health and sustainability. So where did that passion come from, and how did your first idea for your first initiative come about in that space?
Well, thank you for that question. I really appreciate it. As I practiced in the community, because I work directly with women in the community, and these are marginalized women, marginalized adolescents and young adults. As I practiced along the way, I noticed that the informal sector, the vulnerable young people, the vulnerable women are the ones who suffer the consequences of a climate crisis more. And yet they are not really informed about all this crisis and how they can be engaged in mitigating the challenges. For example, I realized that our city, Kampala, when it rains, the water channels can be clogged with plastic bags. And when they clog the water channels, we see flooding all over the place. And these young mothers, the marginalized adolescents and young adults, are the ones who suffer more because they're the ones who are poor, they're living in dilapidated places. That means they're the ones who will get displaced. They're the ones who will get the waterborne diseases, and then they end into our clinic. And then they get malaria. And when they come with babies suffering from malaria, they even don't know how it comes about. But most of them, you will find that it's because of the effects of the climate crisis, and yet they are not aware. And midwives, we are on the front line of care for all these cases. But which information do we have to offer to the population? That is why I said, no, as a midwife, I have to be on the front line. I have to lead this and ensure that mothers, that the community gets to know about the dangers of climate change that we have right now. So it has affected the way I provide my services, because almost every day you can see people going through hardships because of climate crisis. So where shall we be in a short time to come? So I feel that a lot needs to be done, and that is why I am involved in planetary health.
It's a wonderful conversation to have, especially being nurses and midwives at the front line. And I think it's a really, really important issue. And thank you for being at the forefront advocating for this. You mentioned something about your initiative being about paper bags. Can you just tell us a bit more what your initiative is about, who it involves, and what you have achieved so far?
So what I do with the project is that we do produce paper bags as an alternative to plastic bags. And what we do is to involve the marginalized adolescents and young adults in production of paper bags. We provide them with the skills in production of paper bags, in distribution, and as well as in sensitizing the community about the utilization of paper bags in place of plastic bags, which are very, very dangerous to human health. That is what we do at MILCOT. And along the way, even after establishing our clinic, as I have informed you, among the partners we have got is Vaca Health Foundation, who partnered with us, and we established MILCOT General Clinic. And this clinic is to extend services at affordable cost among marginalized adolescents and young adults. But even in this clinic, I trained my team to make paper bags for packaging medicines instead of plastic bags that are on sale. So I have ensured that I am on front line in producing paper bags, training my team, training marginalized adolescents and young adults, so that we really push it forward as an alternative for plastic bags.
That is amazing. Paper bags instead of plastic bags. And I think that's a wonderful solution that works for your local context, but can also, be expanded to the global space as well. So what you have said, like in terms of numbers, what is it that you have achieved so far, and what is sort of your goal, let's say by next year? Like, what would you want to achieve with this initiative in the few years to come?
About 10 marginalized adolescents and young adults have been trained in making paper bags and in distributing them. And what we have also achieved is the collaboration with the community itself. We have extended our sensitization to different areas, churches, and then schools, providing this information that can help to be part of our advocacy. So even working together and sensitizing the community together, because we can't do it alone. So having all this collaboration, I feel it is an achievement, because in a climate crisis, we have a challenge that the communities are unaware. So me involving the civil society organization, the community members themselves to know about climate crisis and the paper bags, the importance of paper bags themselves, and working together as a community. I feel this is something that I have achieved. It is something that is going to push us forward as a whole in advocating for climate crisis, as well as mitigating the challenges by the community themselves. So this is a huge achievement, I feel, that we have achieved. And also the community members to know about the importance of paper bags, and they start to buy them. It is something that is very, very huge. So I am happy about that. And I have big hope that we are going to move forward, especially through local and global collaboration with all other stakeholders.
I mean, I completely agree. Community buy-in is very key in, driving projects and ensuring that, that change is sustainable in the communities that we are engaging with. And so, even just thinking about your project and your experience thus far in planetary health, why do you think planetary health is an important issue for nurses and midwives like you and I?
Nurses and midwives are on the front line of care, are the ones who know the community, are the ones who interface with the patients on a daily basis, So the reason why they are very, very important to be involved in planetary health is because they are the ones who would best understand the challenges that the population go through. They are the ones who can best explain to the community about the diseases that we get, about all the complications that we get through a climate crisis. So, I mean, if nurses and midwives are the ones who interact with patients on a daily basis, then who is the best person to talk about planetary health and also to lead initiatives in planetary health? So I strongly feel that nurses and midwives, even making 50% of the global healthcare workforce, means something. It means that if they have been empowered, they can really take a lead in planetary health, and we can see a huge impact in health.
It's true that we are uniquely positioned, to be able to actually drive these conversations forward. And to somebody who is listening to us today, whether a nurse or a midwife, and they're wondering where to start, what do you think, nurses and midwives can do to sort of like integrate this notion of sustainability and planetary health into their everyday practice? Like, where do you begin that as a nurse and a midwife?
As a nurse and a midwife, you start by, of course, watching the surrounding area where you are, where you work from, your areas of influence. Which planetary problems do you have in the area? And what is it that you can do? Then also, it's important that we get some empowerment. I mean, getting information to learn about planetary health and how to tackle the challenges. But also, it needs to be driven from the passion point of view. I mean, there are nurses and midwives who have seen these problems, and perhaps they have tried to mitigate some of these problems, but they have not been just empowered how they can do it better. So I mean, networking would be very, very important, so that a nurse or a midwife can learn about different initiatives, so that she can also see how to push us forward, or even how she can be supported with more skills, with more information and support per se. So I strongly feel that even in low and middle income countries, everywhere we have these challenges surrounding us. Even in the hospitals themselves, nurses and midwives are there. So it means they need to look around and see where can they fit in the community, where can they fit. And if she picks a problem and she starts to develop an idea, and then we bring these ideas out so that they can be seen, I believe she will start to develop the idea, and these ideas come to life.
I love that. Start where you are with whatever you have. Make sure you get the right information, be informed as a nurse and a midwife, and of course, drawing on your networks that, even just speaking about like networks, what do you think that global networks such as the Nursing Now Challenge, and I think earlier you mentioned the International Confederation of Midwives, what can these global networks do, or how can they play their part in advancing planetary health?
Of course, these global networks, Nursing Now Challenge, International Confederation of Midwives. We have global partners like Vaca Health Foundation, empowering us in sustainability. I mean, some of them have already tackled on this problem. I'm really inspired by how International Confederation of Midwives is empowering midwives who are doing in climate initiatives, and then also Nursing Now Challenge, how we have started to work together to bring out all these initiatives. I mean, empowerment of nurses and midwives. and then creation of awareness among the nurses and midwives. We just need to provide the information to nurses and midwives so that they can know, so that we open their eyes and they know about climate crisis and their position, their strategic position. And then exposing the work that we do. If Nursing Now Challenge, of course, how it is highlighting this work and the work I am doing, and how we are also getting nurses and midwives to come up with initiatives, and then we spotlight them. I believe that is a very big role. And then there's also opening doors for support, let me say resource mobilization, because all these ideas can be developed, but then they need support, they need resources. So if they are brought out to light, then they can be exposed to different partners who can come up with different support that can really develop these initiatives. So I feel that exposure, empowerment can help in supporting planetary health among nurses and midwives.
Yeah, for sure. And I think one of the recent initiatives of the Nursing Now Challenge and the Buddha Trust, they are offering free courses for engagement with nurses and midwives on issues planetary health and sustainability and climate change. So, I think that gives a perfect example of what you've just shared about exposure and, giving them a platform to learn, and to also, giving them the right tools to build their own projects as well. But now, even looking at yourself, Harriet, you're still working in the clinical space. You're now into the advocacy space as well. You're running your own program. How do you balance the practical demands of your clinical role with your advocacy work?
Well, balancing advocacy work with clinical practice. For example, myself, I made advocacy as part of my duty. That whatever I do, as long as it is good, it is advocating for maternal and child health, putting it out there is just an opportunity that it can be seen and it can inspire and influence others, and good work can be seen out there. So, every nurse and midwife, wherever she is, she just needs to know that advocacy is part of her work, should be part of her work, because every nurse is doing a very, very great role. It is great that she just needs to speak about it. For example, if I handle a case and I just write a blog about it, I finish my duty and then write a blog about it, it means I have put it as part of my duty. I've put advocacy as part of my duty. And then in the community context, wherever I go, I meet community leaders. When I meet with global leaders, when I am talking about community issues in my work. And then my position is to talk about the community health challenges, and how can we engage different community stakeholders, local stakeholders, and then global stakeholders. So I really feel that my practice in the clinical environment cannot stand alone. It cannot stand alone without advocacy. We need advocacy. We need to shout every now and then so that our work can be seen, so that women and children and families and communities can receive the best care that they need.
And I think for a lot of nurses and midwives, the problem comes in when we think of clinical and advocacy as separate components, whilst they can be the same. And it's very encouraging to hear how you are, balancing that in your work and still running a very important and very, successful initiative. So looking ahead on the kind of work that MILCOT is doing, what are the hopes for the future of your initiative?
I hope to see communities aware of the dangers of plastic bags. I want to see communities who are empowered, who have been empowered with information and also skills. And I want to see nurses and midwives getting involved in these initiatives. So I want them to frontline planetary health. because we are the ones who are best positioned to tackle these challenges and bring them to light before the community. And then I would like to see this project being scaled up in different areas of the country, in different countries, and also to see nurses and other nurses and midwives in different regions buying the idea and also being empowered to spread all this good practice and help their communities.
Yeah.
That is what I really want to see. And we are planning that we open climate action hubs, which will be resource centers in provision of, climate action information and skills, and also have production and distribution of paper bags and awareness of communities. We see nurses and midwives coming in for skills and information. So I just want to see this work being scaled up in different areas so that it can create huge and more impact.
Speaking about getting more nurses and midwives excited about this topic and actually doing something about it, how can the next generation of nurses and midwives be empowered to take action on planetary health?
The idea itself, the context itself, it's not well addressed in the curricula, in the nursing and midwifery curricula. Not even only the nursing and midwifery curricula, in all health curricula. So I strongly feel that if we advocate for policy changes and develop policies that can include planetary health into our curricula, that will provide skills for nurses and midwives right from the beginning as they grow in their career, and they have the ideas on how to tackle climate crisis in different contexts. I think that will be amazing. Just as we learn about midwifery, as we learn about nursing, can we have the component of climate action? I strongly believe that we can have nurses and midwives who are into problem solving in the area of climate change, and also bringing in these courses, different courses in capacity building. They can help nurses and midwives grow their skills in climate action.
So starting at the very beginning while they're still students, I love that. And so even as we wrap up this conversation, for nurses and midwives who are listening to us today, what would be your call to action, so to speak, for all nurses and midwives in terms of, planetary health and what they can do to improve their communities?
This session is to prick their eyes so that they can also see that climate crisis is a responsibility for everyone. It's a responsibility for those ones who are best positioned like them. So we are here to inspire them. We are here to influence them, and we are calling upon them so that they can join the initiatives that we are bringing up so that they can get involved. We are going to bring discussions through webinars and different engagements. So I strongly believe that this will be a starting point so that they can be interested in these discussions so that they can be supported in coming up with their ideas.
So if you're listening to us as a nurse and midwife, this is your opportunity to start. And we hope that Harriet's wisdom and insights have pushed you in the right direction to start with what you have, where you are at, and drive this conversation forward. So thank you so much, Harriet, for sharing your incredible journey and the work that you're doing to link midwifery and the planetary health conversation. Your passion and leadership are truly inspiring, and it's been a pleasure to learn from your experience, even for me personally. And to our listeners, thank you so much for tuning in into the Grassroots podcast. And if you'd like to learn more about the Nursing Now Challenge and how nurses and midwives around the world, Nayiga being a very wonderful example, are driving change, you can visit our website or follow us on all social media platforms. Until next time, I'm Zipporah Iregi, and this has been Grassroots, where we amplify the voices of nurses and midwives leading change from the ground up.
Grassroots is a production of the Nursing Now Challenge, a program of the Burdett Trust for Nursing. All views and opinions expressed in this podcast are personal to the hosts and guests and are not necessarily the views of the Nursing Now Challenge or the Burdett Trust for Nursing. For more information about the Nursing Now Challenge and this podcast, including upcoming episodes and featured speakers, head over to nursingnow.org.